it's my privilege that I get to work with Dr. Froelich here in South Dakota. And she has quite the extensive background in sheep production. And so I'll let her go ahead and say anything else that she wants to about herself. But go ahead and take the stage, Kelly.
Yeah, thanks, Jalen. So like I was saying, I'm sorry I kind of missed your beginning introduction, so I don't know exactly what you covered. My computer updated and then Zoom was being extra special. But so I grew up in Minnesota. So I got sheep when I was around 13, still have a flock at home with my parents. And I started working at South Dakota State University in August of 2020. And I'm the small ruminant specialist. So today I kind of wanted to talk a little bit about colostrum, and I think it'll be kind of a good follow-up from Dr. Earhart's presentation, because I was hoping that he would, point out, nutrition can have a big impact on colostrum, and he did. So I'll touch, a little bit upon that in my presentation, but he did a very good job, pointing that out. So kind of starting off, and why is it not moving? Okay, so kind of want to start off just talking about, in lamb production systems and even in goat production systems, 80% of those kind of newborn deaths occur, in that first 2 weeks of life. And, whenever I talk to people about, starting off a newborn off right, they should always kind of be thinking of colostrum. So when we talk about, the top, lamb death issues and goats, these are similar issues, we can kind of categorize, the different issues, into a few different categories. So the first one, stillborn, these are like full-term lambs, starvation exposure, respiratory diseases, and then I have another category that's just labeled as other, that's like scours, injury. So in young lambs, is often linked to, inadequate colostrum, can be an effect of bottle feeding. Older lambs, some of these issues can be, just facilities, poor sanitation, high humidity, stress, all of those sort of things. But I kind of wanted to point out, two of these, kind of three of these. So starvation, exposure, respiratory diseases, and to some extent the other, so like scours, you can kind of have an impact on, by just good management in the lambing or kidding barn environment, right? So when we talk about these different things, colostrum can have a big, impact on some of these factors. So, why we should care about these is, lamb mortality, kid mortality, it's wasting money. It's affecting our bottom line. So when we look at these things, if we can get those animals off started right, that's going to really help the efficiency and profitability of your operation. So this next slide, I always kind of throw in here whenever I'm talking about younger animals, is that it's important to kind of keep in mind that, when we have a lamb being born or a kid being born, essentially they're a pre-ruminant, right? They have a rumen in them, but it's not developed, it's not functioning, and they go through this huge transition period, before they kind of get to the final ruminant stage, and it's important as producers that, we're taking good care of them and getting them off to a right start, so we can kind of minimize those death loss issues that I pointed out, in the previous slides, and making sure that they're getting off to a solid feed. So what happens when they're first born, they're considered a pre-ruminant and all of their nutrition is based off of milk and colostrum. And so what happens is, this picture right down here is kind of depicting, what the different stomachs look like, as that animal matures. So at birth, largest, stomach will be the abomasum. So if you remember, or if you have any familiarity, with ruminant animals, they kind of have the 4 stomachs. Rumen is the one, when they eat feed, like hay and stuff, would go into in a full-grown animal. When they're younger, that abomasum, which is kind of similar to like a human stomach, is where all the milk kind of, goes. So young ruminant animals have a special, I guess, what do you want to call it? Physiology that basically when they suckle milk, from the mother or from a bottle, they have this groove that closes and it bypasses all those immature stomachs like the rumen into the abomasum, right? And that's where it kind of goes to start to being digested, and flowing out into the intestine where a lot of those nutrients and stuff are absorbed. So this is just kind of something I always like to point out to people to always be considered. Keep in mind, when you're taking care of these young animals is that they're in a period of huge transition, as they're growing. So we definitely need to be considerate of that and giving them the best start to life as possible. So my first kind of thing that I always like to tell producers is, if you're going to start off a pre-ruminant right, is to make sure that they have colostrum. So colostrum is simply just, that use first milk, contains high concentrations of antibodies or immunoglobulins. So this is, you can kind of think of antibodies or immunoglobulins. They're kind of like the building blocks of the immune system, right? So there's several different types of immunoglobulins. The one that we kind of get most concerned about that we want into those young lambs or kids right away is the immunoglobulin G, right? So you'll see that a lot when if you ever hear anybody talk about colostrum, it'll be the IgG is the one that they always seem to kind of focus on. And basically, these antibodies or immunoglobulins get transferred to the lamb in what's called via passive immunity. And this essentially, only occurs roughly in about the first 24 hours after birth. And the reason why this passive immunity is so important is because unlike humans, a ruminant animal, when they're born, they don't have any immune system, right? It's there, but it's not functioning. And they need to have developed some sort of immunity because the antibodies or immunoglobulins doesn't pass through the placenta. So that is why the colostrum is very, very, very important to get those immunities to the lambs. And so this kind of just initiates that start of the immune system. And I'll probably talk about it a little bit later, but it can, have an effect on, kind of that like starvation exposure, but then also respiratory issues, and also like, things like scours later on. So, and then lastly, colostrum is full of protein, fats, minerals, and other components essential for ensuring lamb survival and growth. So Dr. Earhart, touched upon a little bit, with the different size lambs and brown fat. We all know that if you don't get a lamb or a kid up going, right away, and they're sitting there shivering, they go downhill pretty quickly. So colostrum is kind of that first step, if you can get it into them, it really helps them kind of bounce up and do really, really well. So that kind of passive transfer of immunity. So like I said, lambs are born with an immature immune system, right? It doesn't mean that they don't. Basically, that immune system is not functioning just because it hasn't received any like immunoglobulins, antibodies, so it hasn't activated the immune system, right? And they get that, like I said, through that colostrum. But basically, so that colostrum, the immunoglobulins that I keep talking about, they're absorbed from that intestine into the blood for about 24 hours after birth. And we'll talk about it more kind of in the following slides. Like I said, previous slides, all that milk is going to the abomasum, which then goes to kind of the small intestine. And it's actually in the small intestine that those immunoglobulins get absorbed out into the blood system and can help with that start of that immune system functioning. So when we talk about colostrum, it kind of provides two types of immunity. So just local enteric immunity. So this is immunity kind of in the gut, so small intestine. And this can be helpful, in preventing, like small intestine issues. So that's where I said, some of those issues like such as scours, colostrum can provide, somewhat of a protection against some of those things. So it's really, really important that we get it. And then also colostrum has shown to provide kind of a systematic immunity. So this is just, preventing against respiratory diseases or anything that goes like a systematic body-wide kind of infection or, something like that. So, when we look at colostrum, it has a big, big impact. And the research on kind of the sheep side of things or even the goat side of things on colostrum effects are pretty limited, but there's some pretty good research, if you go digging into like other ruminant species such as like dairy calves, it can kind of affect the future productivity of the animals. It can help with kind of the development of like the intestines, that sort of thing. So then they're more efficient at utilizing nutrients and stuff, and just overall more efficient and productive the older that they get, right? So, there's a lot of things that we're still kind of learning about all of the facts about colostrum, but, if you ever hear, people kind of say that like you need to get colostrum into them, it has, a lot of great effects. And so, it's important to kind of keep in mind that, it is really important. So when I talk about colostrum, there's kind of 3 cues of colostrum that I always kind of bring up to producers. And so when we talk about the 3 cues of colostrum, this is just making sure that the colostrum gets to those lambs or kids quickly, that they get an adequate amount of colostrum, and that the colostrum is actually of good quality, right? So I'll go through each and every single one of these 3 cues, but quickly just means that colostrum, once they ingest it, it gets absorbed from the intestine into blood for, that 24-hour period of time, because after that, the intestine basically closes down and those immunoglobulins, those IgGs, aren't able to go past the intestine into the bloodstream, right? So quantity, these are general rules of thumb, but 10% of birth weight over, 4 feedings in 24 hours, that's just kind of a typical rule of thumb. And then lastly, the quality, there's one paper in sheep that says that in order for lambs to gain that passive transfer or, kind of build up that immune system, is that they need about 30 grams total of IgG in 24 hours. So the reason why we want to make sure that we're getting colostrum quickly to the lambs is kind of two factors, right? So they only provide, those IgGs in that milk, so that colostrum, kind of within that first 24 hours. Once you get past that 24 hours, that amount of IgGs decreases. So then it's not going to have as much benefit to those lambs, just because the IgGs are getting reabsorbed by the mother and is not available. So it said that about 75 to 100% of those IgGs are decreased in that first 24 hours postpartum. And then also, the majority of lambs have an apparent IgG absorption of less than 33%. So when we talk about immunoglobulins and colostrum, a lot of people just kind of automatically assume that all of the IgGs in that milk, all of them are getting absorbed, and that's not actually the case. So at birth, on average, a lamb will, if you had, let's say, 10 molecules of IgGs in the, whatever portion of colostrum that you're feeding, only 33% of that. So just, 3.3 molecules or so, if you want to think of it, being absorbed, to that lamb, right? it's not 100%. So it's important that, we're feeding that high quality colostrum to making sure that they get that amount that they need. And then also just time factor, right? So like Dr. Ehrenhart was saying, lambs are born with a certain amount of brown fat, that can definitely be affected by, the lamb size. But, especially if you're lambing in a colder environment, those lambs, if they're not getting up, nursing on, that mom and getting all those, protein, fat, and energy right away, those fat reserves are going to be, decreased, and they tend to go downhill very, very quickly. So second cue of colostrum management is quantity. So this is just simply how much colostrum are they getting? So the scientific answer on that is, it's dependent on the amount of energy needed for, the heat production and thermal regulation of that lamb, right? So it's going to vary depending on size, how big that lamb is, how cold it is outside. But generally, the rule of thumb that we use is 10% of birth body weight, and that's fed over that 18 24-hour period of time. And obviously, when it's colder, those requirements are going to increase dramatically. So if we were to kind of use this rule of thumb, I kind of put together just like a quick cheat sheet, using that 10% of birth body weight. So if you have 10-pound lamb, that's 1 pound of colostrum or 16 ounces of colostrum within that first 24-hour period of time. The third cue of colostrum management is just quality. So typically when we define colostrum quality, it's, the level of immunoglobulins, right? And it's also the cleanliness of these. So yes, like if you're in a lambing environment and that lamb is up and going, you're probably not going to go and take a milk sample and measure it. But there is, ways to measure quality. So one typical way that, we use kind of like on dairy farms and stuff to know if like, the lamb is getting or the animal's getting adequate amounts of colostrum. They can, feed the colostrum or, take a blood sample later and look at their blood sample through what's called a refractometer. And this isn't looking at immunoglobulins directly, but it's looking at the amount of protein in the blood, which kind of correlates, with the amount of immunoglobulins. So that's one way of seeing if like your animals are getting, enough of a quality colostrum to, obtain that passive transfer. Another way is that we can measure, actually looking at like milk using just a colostrometer. And this is, you would take a sample, this little colostrometer floats in there based off of, that quality and kind of gives you an estimate again of immunoglobulins. So, what we kind of, obviously these two tools are not something that is commonly used or, practice on a sheep farm. I mean, like I said, I have a sheep flock at home and I don't measure, colostrum quality, but this is, kind of where, when Dr. Ehrenhart was talking about, nutrition, making sure that you're feeding your ewes in late or your does in late gestation, good quality, nutrients, this can affect the amount and quality of colostrum. And I also put in cleanliness in here, just from the standpoint, if you have a lot of like bacteria in a sample, let's say you're bottling a lamb, or let's say you're in a lambing environment or kidding environment and it's a really dirty environment, all that bacteria and stuff is going to be sitting on the udder of that animal. And if the lambs or kids are ingesting that along with a colostrum, any sort of bacteria and stuff can kind of have a negative effect on, the amount of immunoglobulins that are absorbed by that animal and can be a detriment, right? So even if you think that you have high quality colostrum, if you have a cleanliness issue in your barn, that can affect that lamb or kid's ability to get use from that colostrum. And one study that I looked at, was based out of the UK, but they kind of did a survey of a bunch of different literature, and they found that the amount of IgGs in colostrum in use is highly variable, right? So they had anywhere from 15 to 79 milligrams per milliliter. And I have a slide on the next slide, kind of showing how that impacts those lambs to be able to get the amount of immunoglobulins they need. And this is just, good to kind of note that, because they were, making a comment that basically almost over 20% of ewes don't actually have, a good quality colostrum to making sure that those lambs or kids get, that passive transfer that they need, right? So I mentioned it earlier before, when we're talking about, these variability in IgGs, lambs need a total of 30 grams of IgG in 24 hours to ensure kind of passive transfer. And that ensures that serum IgG concentration, so if you're taking a blood sample, will be above that 15 milligrams per milliliter, right? So if you kind of plot this on a graph, so this was using a project, they were using Santa Ynez sheep, which is not, in the US, but this is the only study that I found that has kind of stated how much, IgGs that a lamb needs to gain that passive immunity, is that you can see if you look at colostrum quality. So this is, from 0 to 50, which is a little bit short of, the range that I gave on the previous slide, and on the bottom is the amount of colostrum needed in ounces to obtain that 30 grams of IgG. So you can see if you have really poor colostrum quality, that lamb is going to have to consume a considerable amount of colostrum to the point that, there's no way that they would be able to consume that much in 24 hours, right? So it's important that, when we're looking at, that colostrum quality is, doing things such as, making sure that you're feeding your ewes well, and then also, just making sure that you're doing everything possible that the lambs or kids have the ability to absorb those needed IgGs. So, environment cleanliness, goes along, hugely along with that. So this is just kind of summarizing up those 3 cues. So we want to make sure that, our lambs or kids are, drinking colostrum quickly. So making sure that, pretty soon after birth, that they're going to get that colostrum, making sure that they are getting the right amount of colostrum that they're getting, and then also just quality, right? So I kind of have this question here: how can your management affect colostrum to the lamb or kid? So, when we're talking about these different things, obviously if you have a bottle baby, or if you're a producer who, automatically tubes, their lambs or kids, with colostrum right after they're born, you're going to know, how much colostrum they're going to get, and how quickly they've gotten it, right? If you're in a lambing shed and you're relying on the ewes and the lambs, to get up, drink on their own, things, they're still important, but you can still affect, that management, and when those lambs or kids are getting colostrum, just by, kind of that ewe management, making sure that they have, that your barn, your environment is clean, that those immunoglobulins are going to be absorbed, that your ewes are getting fed, really well prior in late gestation, so they have enough milk for all of their lambs. If you have triplets, or quads or something, and you need to pull a lamb, making sure that they get, colostrum from, another source if that ewe does not have enough to feed all of her lambs or kids. And then the last few slides that I have is kind of talking about, what to do when mom has, no colostrum. So this is more in reference to kind of, if you get a bum lamb or a bum kid or just a ewe with no bag, no colostrum. The first thing I always like to, talk to students, or producers is that you should always make sure that, your lamb or kid, before you do anything, is it warm, right? Oftentimes, some will go out to the barn, maybe you had a ewe or a doe lamb or kid, and you don't know when it came out, but the lamb or kid is cold. It's important that you make sure to warm them up before you tube them anything. So, normal temperature, 101 to 103.5 Fahrenheit. If they're below that and hypothermic and you try to, force colostrum, warm colostrum down them or tube them, you can shock the system and actually end up killing that animal. So it is important that you get them warmed up before you do anything else. And then kind of the second step is, feed colostrum. Obviously, if they're, strong enough, bottling is always a good one. If you can, tube that animal, there's also an option of doing that. So down here, just kind of a picture of, a lamb with a tube. And typically, most of if you get the tubes or whatever from a commercial source, they're about the length that you need, but just for reference, when you're putting it down the mouth, the tube should go out to kind of that last rib, if you were to stretch it over that animal, if you just weren't sure how far to put it down. And then, kind of another option, that I'm not going to go into super in depth about is, if you have the option, grafting that lamb or a kid, onto the doe or ewe can definitely be another, great way to making sure that they're getting that milk or colostrum that they need. The only thing I would say about grafting is, you have to have a ewe or, doe that, kidded or lambed, pretty close to whatever lamb that, or kid needs help. So to make sure that they have those, amount of IgGs, in that milk. So when we talk about, sources of colostrum, I'm a big, advocate, for saving your ewe or doe colostrum from your own herd. This is going to be your best source, simply because the antibodies that are going to be in that colostrum is going to be specific to your farm, right? Kind of the second, option that you could do, is used quite a bit is, finding an alternative source like, from a cow or a goat. It is kind of important to note when you're looking at using that, they do have, a lower nutrient value than, sheep milk, right? So if you're feeding a ewe flock and you're, sourcing goat colostrum, goat milk, is a lot lower in nutrient composition than a sheep. So this is kind of just like, a table down here that's showing the different fat, protein, lactose percentage, by, sheep, cow, and goat. So you can see, a cow and a goat from a component standpoint, they're a lot similar than, let's say, sheep, which has a lot higher amount of fat in it. And then it's also important to note on cows, they have the highest lactose percent, which, so if you're feeding, like a bum, strictly cow milk, because of that higher lactose, they can actually cause a bit more scours and that sort of thing in those animals. And then my last little point here is, if you are sourcing, colostrum or milk, to feed a bum, it's just making sure that the disease status of the animal. So some things like Johne's, kind of like a wasting disease, can be transferred from a cow to a sheep. So it's good to kind of know that, your source, is kind of free from those different things. Then the last one, if you can't get a hold of, any of those sort of things, is powdered colostrum. And I always like to kind of point out that with your powdered colostrum, it's important that you're looking at the label and seeing what you're getting, right? Because it's not all the same. There are a difference between a colostrum replacer and a colostrum supplement, right? So a supplement is not going to have enough IgGs to obtain that passive transfer for those animals. So a colostrum replacer should have somewhere on there that it says 150 to 200 grams of IgGs, which is not going to be the same concentration. A supplement will be much lower than that. And I also like kind of, make a note to, whenever I've looked at colostrum replacers, if you, kind of do the math, and if we use that research from that sheep colostrum work that lambs need, that 30 grams of IgGs, feeding one feeding from a colostrum replacer is not enough to obtain that 30 grams of IgGs. So you do, in my opinion, need to feed more than one feeding to making sure that your animals are getting enough IgGs, which if you've ever looked up, colostrum replacers, gets really, really expensive. So that's why I kind of have it last on my list, because, obviously, getting colostrum from your own flock is going to be a lot cheaper. But your second kind of bet is, getting something from another species, such as like a cow, to feed yours, because that will probably be more cost effective than trying to feed a powdered colostrum. And then, so I have a little note here on just kind of colostrum storage and handling. And again, this is kind of a rule of thumb. But, just making sure that if you're milking out colostrum from your flock, is that you're being careful to, when you're milking it out, just be clean. And then these are just some rules of thumbs, but milk is a good substrate for bacterial growth. So if you're not using it right away, put it in the fridge, or store it in the freezer, just to minimize, that bacterial contamination. And so that when you do use it, it's going to have that benefit and not have that bacterial load that can potentially affect the amount of immunoglobulins that animal can absorb out of it. So at the unit, we always kind of put colostrum in small, like 4-ounce bags. That makes it really handy, for you can just pull out a bag, it unthaws quickly, and it's kind of one feeding right there, or you can pull out 2 if you have a bigger lamb or something like that, but that's a good kind of trick, is to feed it in smaller amounts. If you freeze it in a big gallon Ziploc bag, the chances of you using it all are pretty slim, unless you have lots of lambs all of a sudden all at once that need colostrum. And from an immunoglobulin standpoint, if you're taking, that colostrum in and out, always, freezing thawing, you can destroy those immunoglobulins. Another good trick that I've kind of seen is, freezing the colostrum in an ice cube tray. So in a standard ice cube tray, 1 cube is about 1 ounce. So you can just take out the number of cubes that you need for, the size of your lamb, and that's also an easy way to kind of unthaw that colostrum and kind of use it right away. And then it should be, hopefully you've heard this before, but you should not microwave, your colostrum for reheating it, just simply because microwaves destroy those immunoglobulins, and it won't be there for, those lambs or kids. So the best way to do it is kind of thaw it out in a warm water bath. And that's why, freezing it in smaller amounts, makes it a lot easier to use than if you put it in one big batch. And then I put in this slide too, because this is kind of important to note. So when we talk about, whatever vaccine that you vaccinate your flocks with, I put in CD&T because, this is kind of, if you're going to vaccinate your animals with anything, it should at least be CD&T, right? It's important that, when you're giving like boosters and shots and stuff, it's good to kind of give that to the animals prior, like a few weeks prior to them lambing, because that ensures that those, antibodies, so in this case, we're talking about Clostridium, is going to be in that colostrum, right? Because when you give an animal an injection, it has an immune response, you get in a level of antibody. And if you do it, a few weeks prior to the lamb, then it's also in the colostrum, and it provides, protections to those lambs that are born, right away. So like I said, in the way beginning of this presentation, when lambs are first born, they have an immature immune system, right? They don't have any ability to really recognize, any foreign bodies, that sort of thing, just because, their immune system has never had to do anything with that, right? So when you're, there's some people that will give like a CD&T shot, right away at birth, and that doesn't really provide much protection, from what I've read, to those lambs, just simply because that immune system cannot recognize it. I mean, the vaccine is different than, let's say, like antitoxin. If you're giving antitoxin, right away when they're born, that provides, a level of protection, but it's not creating immune response. So it's not a long-term immune response, if that makes sense. But I like to put this out here. If you do whatever you're vaccinating for, if it's something that you think that the lamb should be protected from, it's not a bad idea to kind of give your boosters or time your boosters, right prior to them lambing, so those antibodies will be in that colostrum. And then kind of in summary, so ensuring lambs receive the 3 Qs of colostrum, so that quickly, quantity, quality, kind of just help increase lamb survivability and also increase, your profits. So with that, are there any questions?
That was great. Thanks, Kelly. There are a couple of questions.
Okay.
So one that popped up a couple times is there a way that your management can change the quality of colostrum, or is it something that's genetic?
Yeah, that's a little bit, I would say the research on like the sheep and goat side of things are very, very limited, but from everything that I've seen, it's more of a management side of things. And that's not to say that there isn't a genetic component, but I haven't seen that. So if possible, right? But I guess I kind of always advocate, the one thing that you can definitely do right now is just, having a good level of management.
Yeah, absolutely. There's several on what's passed through colostrum. One of the questions is, are vitamins passed through colostrum based on the used vitamin levels? So the vitamins and minerals we're feeding to those ewes in the last 4 weeks of gestation.
Oh boy. I don't believe vitamins, and I don't know if Dr. Earnhardt, but I think that's more of kind of like a, higher in like, gestation kind of thing than in colostrum. I think it's mostly just kind of your, like, your fats, minerals, that sort of thing that passed in. But don't quote me on that.
Yeah. So another question is, how do you know how much colostrum you should take? So like, let's say your doe kidded and she's got twins, but you want to have some colostrum on hand. How would you recommend to go about collecting colostrum from, and what's too much or not enough?
Well, that's going to depend a lot, I think, on the animal, because some, naturally produce a lot more milk and colostrum than others. I guess my advice is, kind of take an assessment. You can kind of usually see how big a bag is, if she has an abundant amount of milk, you can tell pretty quickly by milking it out. If you milked out, let's say 8 ounces, and it doesn't even look like you milked her, that she'll have more than plenty for, that lamb or kid. So I think you kind of just have to, look at it, on a case by case basis, on that individual animals. So, my recommendation is just, milk a little bit out. And if it looks like you haven't really touched, her udder, then you're probably more than fine. If you start milking her out and it looks like her milk is depleting, then I would say stop to make sure that your animals, your lambs or kids have enough.
Yeah, and I would say make sure that her kids or lambs get enough first, and then
Yeah.
you can
Yeah.
take some. So this one asks, and you kind of alluded to this a little bit, but can you talk a little bit more on how and if heat treating colostrum affects the efficacy of the IgGs?
So I think it depends on how it's done. So if it's like a low temperature, like longer heat treatment period, that doesn't have any effect on the IgGs. It's when you're using really, really high heat, then that starts denaturing the protein. So most of the like recommended, what do you call it? Protocols or whatever for, heat treating colostrum, like, let's say on dairy farm or whatever, that's not going to affect the amount of immunoglobulins.
There was early on a question when you talked about rumen development. Can you talk a little bit about how the introduction of grain and hay influences rumen maturation?
Yeah, I didn't, I should have put the slide in there. Yeah, so like, different feed stuff, has an effect on that rumen development. So like I kind of showed on that phases of development, when the lamb kid is first born, basically the rumen's there, but it's small. And if you were to cut it open, like it's completely smooth, right? On an adult animal, if you were to cut it open, they have what's called like papillae, kind of just like it's a bunch of little fingers, all over the mat that gives it more surface area for kind of nutrient absorption. And so like if you're feeding, I always recommend, when you're feeding those young animals is that you're feeding kind of a higher quality like starch kind of feed, because that starchy feed actually is what helps develop and start the initiation of that papillae growth. So that will better help, them to develop that rumen than, feeding, let's say, just straight milk or straight hay, right? They'll have a rougher surface, more surface area if you're feeding that starch.
Okay. What's your thoughts on colostrum supplement as like the oral gel? If your colostrum quality is not known.
I guess, I haven't really been exposed, I guess, to colostrum gel all that much. I guess the main thing is, look at the amount of immunoglobulins in it, right? Because that will tell you, how much is in there, because that's the important bit. It's not necessarily, everything else. It's, yes, the like energy and stuff in there is important, to get that lamb or kid going. But the immunoglobulins is what helps, initiates and what we want a lot of to kind of get their immune system started.
Well, and I think it goes back to like you were saying about it being a nutritional thing. So if you're managing your use properly, your colostrum quality shouldn't be quite as big of a concern.
Right.
That's most of the questions. Some of these you hit on. There was a question and it came in prior to you discussing it, but can you talk a little bit more just on how we know that a colostrum replacer is high quality?
Yeah. So my biggest thing is, if you're looking at label, is looking for that amount of IgGs, right? So a colostrum replacer should have, 150 to 200 grams of IgG somewhere on the label. I kind of advocate for the higher one just because, it'll ensure that they're getting more IgGs, which should hopefully help, they get all the immunoglobulins that they need. And like I said, they're going to have to, if you use the research, that shows, that they need that 30 grams of IgGs total to get the most amount of passive transfer, you're going to need to feed it more than once, right?
Yeah, so there was one question, and I don't know, we can open this up to everybody because it's not colostrum specific, but talking on kind of that passive immunity. It's recommended to give CD&T vaccine 3 to 4 weeks prior to birth. How does that also help against tetanus?
So, did you want to tackle that, Dr. Herrenhardt, or? I mean, from my understanding, so like that graph that I showed, I mean, that's any antibody level, right? So the one study that I'm thinking of that was done, was it Cornell that did it? They weren't necessarily using CD&T in their study model. They were using, I forget what it's called, but it basically creates an immune system. And what they saw was that, within that first couple of weeks, the lambs don't have ability to kind of recognize what, if you're giving it to the lambs, but if you're giving it to the ewes prior, those antibodies will be in the colostrum. So from my understanding, and Dr. Ehrenhardt, you can pitch in, if you're giving the vaccines prior to them, lambing or kidding, those antibodies should theoretically be in that colostrum.
Yeah, I think you got it perfectly right. The only thing I'd add is I wasn't really involved in that study. It was happening when I was there. Yeah, that study looked at, it was just enterotoxemia. So it was epsilon toxin. So it's just, for type C and D. So we don't really know if that holds for tetanus exactly, same case, but let's just say it does. I think it's good to recognize that passive immunity is really what you're going to protect those lambs and kids, at least in the first month of life, maybe even up to 2 months. And they're not going to see much response to any injections done, certainly before a month of age. So the old adage of, giving them shots at birth, and a lot of my producers still do that. It really is a waste of time and effort. You got to make sure you give it to the ewes, as you're saying, and get the passive immunity built up into the colostrum. And then you still need to vaccinate the lambs, especially if you keep them as replacements, to give them active immunity. But it isn't going to really do much good until they're close to weaning.
Yeah. I mean, the only thing that could help them, and I mentioned it, if you're doing antitoxin or something, if, you could give it to them, but it's important to know that that antitoxin is different than the vaccine, right? It's not making the immune system recognize that. It's just providing a short-term
the antitoxin
protection.
Just, giving them passive immunity again, just like colostrum, right? You're just giving them antibodies that, give them immediate protection. So people always ask me, who are, mostly the smaller farmer who wants to do everything perfect, right? They have some bottle lamb, they couldn't get colostrum in them, and they go, how can I keep this lamb from getting overeating disease? I'm very worried. I'd say, well, if you really want to feel good about things, you've done your very best, you could give them some antitoxin, kind of like the ultimate thing to do. But most people don't routinely do that, right?
Right. And it's also very difficult to find right now.
Right. So it's I just am backing up what you're saying, I guess.
So I guess still kind of deterring from the colostrum conversation, but down the same kind of immune response. There was a question that came in about why sometimes when we give a CD&T injection, we get essentially a abscess, if you will, and how do we help avoid creating those abscesses?
Do you want to tackle that one, or?
I'm not sure I'm any perfectly but any more than anyone else here, but a lot of those abscesses, and I train lots of people in giving injections, right? I teach veterinary students especially, and a lot of it has to do with like how clean you are with your needles. And if you give a subcutaneous injection, you should never really see an abscess. If you go like through the, both layers of skin, you won't. I see a lot of people make mistakes and they'll give an intradermal injection, like they'll go right between the layers of skin. And I think, that may introduce some bugs into the shot, or it may just elicit like an abnormal reaction. But most of the vaccines, most of them, that's not all. Most of the ones approved for sheep and goats aren't going to give much of a reaction site, and they shouldn't give an abscess. So it allows has to do with your cleanliness of how you use needles and your technique. And I'd suggest if you're having problems with that, change needles more often and make sure you go through the layers of skin. And like, do you have anything else to add?
No, that was kind of my initial thoughts. And also I think like, giving it in the armpit, where they're moving and stuff can help kind of work it in a little bit. So maybe if you don't get it, through both layers of skin, that you won't get as much of an abscess, but I'm not sure that's based off of anything really scientific. But I know in my experience when I've, done abscesses, on sheep with CD&T, it was probably more my technique, and it's usually, a couple. So if you're getting a lot, is maybe visiting with a vet or something, and, just have them show you, how to give it. So you can help minimize that.
Well, I'm not seeing any more questions come in. So thanks again, Dr. Froelich and Dr. Earhart. This was, I think, some really, really good lambing time discussions.